Hi, I'm Andrew Bonello and I am the president of Relief Malta. The chemical difference pertains to the THC to CBD levels. In medical cannabis we find higher levels of CBD, where in the recreational market we find very low levels of CBD. Now CBD is used to counter the effects, the psychoactive effects of THC. We are seeing that in countries where cannabis is legally regulated, like in USA and Canada, the trend is towards having more CBD within the plant.
My name is Andrew Ajus. I'm a medical doctor and I manage the pain clinic in Paula. CBD has been declared as safe for human consumption in 2017 by the World Health Organization. And since then, there has been various different laws in different countries throughout Europe which classify CBD either as a food supplement or as a cosmetic.
People use cannabis for different reasons. The main perception is that it makes you lazy or not get things done, when we know there are people like Steve Jobs and Michael Phelps who are extremely successful people. Research shows that cannabis consumers are active members of society, and in a regulated cannabis model, it makes it all the more easy. By all the more easy, I mean not having to deal with law enforcement and everything that goes with it.
When it comes to medicine, in Malta, CBD is not available yet, except in one of the products, which is a dried flower preparation, where it is also present with THC. There are no CBD-only preparations available as medicine in pharmacies in Malta yet.
Cannabis has numerous amounts of different strains. As a consumer, you need to find the right strain that works for you. There are two major strains that we deal with. One is sativa and one is indica. Sativa is known to energize, whilst the indica is more of a relaxant. The effects of cannabis use depends a lot on why the person is using it and, of course, the THC to CBD levels.
Medical cannabis is mainly indicated in cases where conventional medication hasn't proved to be fully effective. One classical example of this is chronic pain, where the therapeutic options are limited. We have the opioids and the NSAIDs, which both can cause side effects when taken long term. There are also other drugs that are sometimes used, like anti-epileptics, but all of these can sometimes cause more side effects than actual relief from symptoms. In these cases, medical cannabis can provide a safe and effective alternative, and many patients can get long-term relief without the side effects associated with this medication. In the short term, medical cannabis can be very quick and effective to provide relief of symptoms, especially when it is vaporized. Vaporization involves heating the dried cannabis flower and inhaling the therapeutic vapor to obtain a very quick and effective relief of symptoms, such as, for example, chronic pain and anxiety.
Cannabis is fairly easy to find in Malta, and the prices vary, as do the quality. You can go from €7, where you will get poor quality cannabis that can be sprayed with pesticides, and €25 will get you decent cannabis. Obviously, this is per gram. Furthermore, with current drug policies, consumers don't have access to information to know what they are buying. Therefore, will not know what levels of CBD to THC are present, if it's an indica or if it's a sativa. Basically, they have no information at all. They are unable to learn and understand what strain works and what strain doesn't work for them.
Medical cannabis can be prescribed by any doctor in Malta that is registered with the Medical Council. Unfortunately, not many doctors are confident enough to prescribe this medicine. I think we need more education in this subject. Any doctor who feels that his patients can benefit from it can fill the appropriate applications and the appropriate forms, and after getting approval from the Superintendent of Public Health, the patients can access medical cannabis products from any pharmacy in Malta that approves it, with a prescription, a control card and a permit from the Superintendent of Public Health.